Patients with neurologic disease have high impact on quality of life and large disability. There's a high level of mortality also due to these diseases. Not only for the patients themselves, but the impact is huge on the families and on caregivers as well. I think the biggest challenges that I learned in my career of over 20 years is that there is a huge gap in the diagnostics of patients, in early recognition of the disease, which also would lead to delayed treatment and optimal treatment and management. And I think if we would really think about one thing that we as a community should do, this is patient education and patient empowerment.
Spasticity, drooling, and dystonia are stigmatized diseases. As a society, I personally believe we have to overcome this stigma and ask for the help for these patients to do better.
Research tells us that these patients frequently don't mention these symptoms to their physician. So if they are not proactively asked, then it's simply forgotten and overlooked. But on the other hand side, think for example on sialorrhea, which is drooling. This comes with a social stigma. So another reason for patients not proactively talking about, but on the other hand side, this hinders then their participation. They feel ashamed, they stay home.
In order to make therapies in neurology available to patients, we have to undergo a long, complex development process that includes preclinical trials, clinical trials, as well as a regulatory review. And when we're developing these trials, we try to make it relevant to the patient by incorporating functional outcomes that are appropriate for their symptoms.
Our focus is on developing late-stage products, which means new indications, but beyond this also overall solutions which help patients who suffer from chronic neurological conditions to live their life at the fullest and to achieve their treatment goals.
So what sets Merz apart in the specialty neurology landscape? Well, it's a couple of things. The first is we have a very strong set of products that meet unmet needs. We also have some great capabilities, very strong set of clinical ability to develop as well as commercial capabilities. Our vision is also truly inspiring. Our goal is to develop innovative medicines for patients that have big unmet needs.
Access to care and access to health is probably the motto of the next decade when it comes to healthcare. On the one side, developing innovative drugs has absolutely no value if these drugs remain inaccessible for the breadth of the population.
Merz Therapeutics defines value beyond the medicine by engaging in education with our early clinicians, established clinicians, and most recently working with patient advocate organizations to ensure that every stakeholder across the healthcare ecosystem has the best education and the best access to medication. The collaboration across sectors is vital in specialty neurology, primarily because each stakeholder does something exceptionally well, whether it's early clinical stage research, commercialization, or even preclinical research. Each stakeholder has a specialty, has an area of focus, and we enable each other to bring more innovative medicines to patients.
We partner extensively with various stakeholders, including the experts, patient and patient organizations, with payers. It is really critical to ensure that we all share our perspectives when we start bringing the best outcomes for the patients.
The goal of Merz Therapeutics is to provide value beyond our product portfolio. We're continuing to develop innovative tools and programs to help educate and train our physicians. We have a virtual reality program where physicians can learn anatomy and practice their injection techniques in a controlled environment. We also recently launched an anatomical arm model that physicians can use to practice their administration techniques, and this can be applied in the clinical setting.
Our vision at Merz Therapeutics is to be a leader in the field of specialty neurology. We'll continue to be a leader there by investing in research and development for future innovative treatments.